Kia koutou katoa, ko Rick Lomax tōku ingoa. Yeah, I do work for Beca. We are renowned to be an engineering firm, but we do actually have an awesome team of sustainability advisors who we go out and do talk about sustainability decarbonisation on a daily basis, which is awesome. So I had the pleasure, I used to work in the National Health Service's Sustainable Development Unit. I worked there for about 4 years and recently moved, well, recently 2 years ago nearly now, to New Zealand, and really love working in the health and sustainability space in the area, just because it's such a win-win in terms of we can actually really embed sustainability in what health does. Actually, we can help health solve some of its own problems. I've been tasked with the very complex issue of dealing with supply chain emissions in 10 minutes. I am going to disagree with nearly everyone who's been up here and presented that this is the biggest part of a DHB's carbon footprint. And I feel like I've probably got the answer that's the true one, but I'll let you make that call. So I thought I'd start with a story. Not all cycles are good. So this cycle is bad. We have air pollution rising, especially in our city centres. Air pollution exacerbates asthma, it's been proven. Then we use more inhalers, and someone stole my thunder about inhalers earlier, but it's all good, which usually ends up driving more and more healthcare attendances, which mean more people are driving to access healthcare, which makes air pollution worse. This is a cycle that's in every developed, healthcare system. So it's definitely not just poking fun at New Zealand here, it's lots of them. So inhalers, some meter dose inhalers having a propellant in them that's 3,000 times more potent than CO2. Not good news. All of these things with the red arrow are actually making climate change worse as well. But we do have some touch points. So as David Pension again stole my thunder this morning, someone wrote the contract for these inhalers. Someone prescribed them to the inhalers, and someone developed a care pathway that said we need to drag patients to a hospital every time they need to be spoken to. So there's lots of touch points and lots of different opportunities to break said cycle. I also feel if there's any asthmatics in the room, I feel like you might have been gotten at a little bit today. It's definitely not your fault, but I do ask you to go talk to your GP at a relevant point, and maybe have a telephone conference and talk to them about your options around a DPI. So the question is, are supply chain emissions significant? The answer is yes. So just make the point. So this is taken from the NHS carbon footprint. We recently did a piece of work with Auckland DHB that did their full carbon footprint for the first time. So included all of their procurement, their supply chain, and the kind of order of magnitudes are about the same. The DHB are still going through the results, so I didn't want to share them today because I think the CFO and Chief Medical Officer is still trying to pick his jaw off the table. But the good news is, so all the green stuff is the building energy usage that we've talked about, and I don't want to discredit the awesome work that DHBs are doing, the awesome funding that ECA is providing. Like, these are all awesome solutions, but we're still stuck in kind of the efficiency space, and we really need to start thinking about transformation. So try and explain in this chart. So building energy, water waste, business travel and fleet, all the kind of standard direct stuff that most DHB measures, which is really important to measure. We've got anesthetic gases and meter dose inhalers, was around 5% of the footprint. Patient travel, staff commuting, visit travel. So that's the stuff about getting people to site is quite significant. But the big blue issue in the room is supply chains around 60 to 70% of the emissions. I say that's the similar numbers we got from the exercise with Auckland DHB. So why, and we've mentioned this, everyone's mentioned this today, which has been awesome. Like, we make decisions on what we've measured, but what the point I'm trying to make here is we often measure the less than 20% of the problem. We probably sometimes measure the other bits, which was anesthetic gases and patient travel, but we very rarely in the health sector actually measure the biggest problem. It's a bit more clunky to measure, it's a bit more clunky to calculate, but in reality, we should probably go that extra mile. And the reason it's important is the scale of the problem starts to open up new solutions and different opportunities, which all roads point to public health and prevention, which I think everyone in the room can agree is actually the place we want to play in. Wouldn't it be great? Sorry, someone tasked us with the question of what's our vision for a sustainable healthcare system? And actually, for me, it's one where, like, we've got 50% less hospitals in the world. We've got a lot more people that assume a doctor and a nurse isn't based on attending a hospital. There are people that help you be happy and healthy on a daily basis, which I know they already do to some extent, but it's very much on an illness treatment basis. and not on a how are you doing, how can we continue for you to be happy and healthy in your day-to-day life. So what I wanted to just kind of break down some of the very high level solutions, and I appreciate I'm trying to do this in 10 minutes and it's a way more complex problem than this, but this is a very, very simple overview of a hospital supply chain. So we've got patients in the top right-hand corner, they attend the hospital in the middle. We've got the supplier and the importer who sells goods and services to treat said patients. And so a lot of stuff gets used and it gets thrown in the bin. And there's some awesome examples of trying to avoid the bin, which is great. But unfortunately, climate change is going to increase the number of patients more often, more complex conditions. We've talked a lot about kind of flooding and anxiety and all the different physical impacts that climate change is going to have that the Minister mentioned this morning. So that's going to make our problem harder, not easier. But there are responsibilities, there are solutions. And I definitely think all the work that DHB is doing is incredible. I think they need more support at that much more strategic level to help actually unpick some of these solutions. So imagine if we could solve 35% of the problem, roughly a third, by really focusing on public health and really putting that funding into public health. Definitely think Pharmac, Ministry of Health, and my beautiful image of the beehive can really help solve some of those problems as well. You know, they set some of the strategies about how and why a patient gets treated. Actually using carbon as a lens, whoever said that question earlier is a hero. Using carbon as a lens in that decision-making is absolutely key. I think there's a whole other people responsible at the DHB level as well. So they are part of the solution, which is awesome. Imagine if we could divert 20% of the goods turning up a hospital by thinking about the procurement process. We talked about contracts earlier with David Pension. It's really, really key to embed in that thinking at that highest level. How do we redesign care pathways to be the lowest, the healthiest care pathway it could possibly be? And industry is definitely part of the solution. I don't think it's the only solution, because I think sometimes we expect industry just to innovate and solve all our solutions, but they are definitely part of the problem. Sorry, part of the solution. So what if we can look at lower carbon products, looking at more circular approaches, and have some early examples from Oz, which were really exciting. What I do want to labour the point behind is, yes, we need to manage waste, but that is the downstream problem of all these other systems failing in the first place. So yes, we need to make sure things are avoiding landfill, but if we solve the problems up in the more upstream space, the reality and the co-benefits of what we can create is huge. So, key messages. It's the system supply chain, it's our supply chain, it's patients, it's people working at DHB. We should really be measuring it, and we should be measuring it as often as we can, maybe not every year, but every couple of years, every 3 years, just to sense check where we are. Absolutely focus on the upstream solutions. How do we actually help people not turn up at a hospital? Wouldn't it be great if we can invest in even more healthier homes? So the reason why people didn't turn up at a hospital was because their heating system didn't work or their homes weren't insulated enough. Like, that's a failing elsewhere in the system. As we mentioned earlier, the ambulance at the bottom of the cliff literally is the ambulance. The cool thing is the work we've done with ADHB, Auckland DHB, was to take their carbon footprint. We increased it sixfold, I think, thereabouts. And what we did is actually looked at that emissions profile over 30 years. And we looked at all the different solutions, all the different wedges, I think someone else mentioned, that could be employed for the DHB across its supply chain and across its direct emissions. And I think the key next step off the back of that is really using carbon as a lens in decision-making, in procurement, in care pathways, and in day-to-day decisions.